Good morning to everyone, to Pepe Mejia, who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of one person with COVID-19 yesterday. The patient was a 50-year-old woman from the municipality of Cerro Redondo in the province of Ciego de Ávila. She was admitted to hospital suffering from an illness unrelated to COVID-19. There, she underwent a test for the virus, which came back positive. The patient spent 27 days in hospital, 11 in intensive care. Her health began to deteriorate significantly around the 15th or 16th of September. She suffered cardiac arrest, and our health professionals managed to revive her. However, unfortunately, her condition continued to worsen. She suffered cardiorespiratory arrest yesterday, from which it was not possible to revive her, and the patient sadly died. We offer our condolences to the friends and family of the deceased. Today, 7,794 people are hospitalized in Cuba. 5,880 are under observation. There are 1,353 suspected cases and 561 confirmed active cases. Yesterday, we processed over 7,000 samples, 7,598 in our various molecular biology laboratories. 2,343 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 981 in Havana's Hygiene, Epidemiology and Microbiology Center, 821 in Villa Claras, 502 in Santiago de Cubas, 573 in the Genetic Engineering and Biotechnology Center Lab, 494 in the Hermanos Almaheras Hospital, 413 in the Molecular Immunology Center, 338 in the Fructuoso Rodriguez Hospital, 313 in the Manuel Fajardo Hospital, 303 in the ICA Laboratories, 286 in the Naval Hospital, and 231 in the Civil Defense Laboratories. Of these 7,598 samples processed, 50 tested positive for COVID-19. That's 50 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 546,250, of which 5,141, or 0.94% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested, the most from Havana with 4,607, Mayabeque 223, Matanzas 340, Sancti Spiritus 539, Ciego de Ávila 533, Camagüey 352, Holguín 401, Santiago de Cuba 163, and so on and so forth from all of the country's territories. Of the 50 positive cases diagnosed yesterday, 48 are Cubans and 2 are temporary foreign residents in the country. 40 or 80% of the 50 positive cases diagnosed yesterday are confirmed case contacts. This means that 90% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. This is the group at highest risk of infection. Of the 50 cases diagnosed yesterday, the source of infection linked to 10 is yet to be determined. The source of infection in 69 cases reported over the last 15 days is therefore still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, meaning that imported cases remain at 440. Let me reiterate that the 2 temporary foreign residents diagnosed with the virus yesterday contracted it in the country and are not, therefore, imported cases. Of the 50 diagnosed cases yesterday, 28 are male, for 50.2% of all cases, and 22 are female, representing 49.8% of all diagnosed cases on the island. 35 or 70% of the 50 cases diagnosed yesterday were asymptomatic at the time of testing. Overall, therefore, 59.5% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. And this figure rises to 63% of cases over the last 15 days. By age group, 10 positive cases diagnosed yesterday are under the age of 20. All are in fact under 18 years of age, for a total of 550 children or pediatric cases to have tested positive for the virus in Cuba. Of these, 483 or 87.8% have recovered from COVID-19 and been discharged from hospital. It is also worth mentioning that, to date, no children or pediatric cases have died of the virus in Cuba. Meanwhile, 18 people to have tested positive for the virus yesterday are between 20 and 39 years of age. 19 cases are between 40 and 59, and 3 are over the age of 60. Of the 50 cases diagnosed yesterday, 31 belong to Havana, 7 to Matanzas, 5 to Ciego de Ávila, 3 to Artemisa, 2 to Camagüey, and 1 case each to Mayabeque and Sancti Spiritus. Of the 50 autochthonous cases, the 3 from Artemisa all belong to the municipality of San Cristobal. The case from Mayabeque belongs to the municipality of Guines. The 7 cases from Matanzas belong to the municipalities of Cárdenas with 6 and Unión de Reyes with 1. The 5 cases in Ciego de Ávila belong to the municipalities of Ciego de Ávila with 4 and Baraguá with 1 case. The 2 cases from Camagüey belong to the municipality of Jimaguayú. The case from Sancti Spiritus belongs to Yaguajay, and the 31 cases from Havana belong to the municipalities of 10 de Octubre with 7, Regla 4, Boyeros, Centro Habana, San Miguel and Marianao with 3 each, La Lisa with 2, Arroyo Naranjo also with 2, then Habana del Este, Playa Guanabacoa and Plaza with 1 case each. An important piece of information of interest to the population is that all 50 people diagnosed with COVID-19 yesterday were already in hospitals or isolation centres. Given yesterday's results by province, therefore, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 60.85. Havana follows with 18.78, then Artemisa with 7.57, Sancti Spiritus 6.87, Matanzas 6.81, Mayabeque 3.64, Camagüey 1.05, Pinar del Rio 0.69, Cienfuegos 0.49, and Holguín with a rate of 0.29. Las Tunas, Villa Clara, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have reported no new cases of COVID-19 over the last 15 days. Cuba's rate therefore stands at 7.30 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,141 people who have been diagnosed with the virus thus far in Cuba, 561, or 10.9%, are active hospitalized cases. Of these, 548, or 97.7%, are clinically stable. Yesterday, one person died as a result of the virus, meaning that the COVID-19 death toll on the island now stands at 116, with a mortality rate of 2.25%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 50 people were discharged from hospital. This means that, to date, 4,462 people, or 87% of all confirmed cases in Cuba, have recovered from the virus. Today, 4 patients being treated in Havana and Camagüey continue to be in a critical state. 9 patients in hospitals in Havana, Camagüey, and Matanzas are also reported as serious. Yesterday, 1 new patient joined the group of those reported as critical, while 2 passed from serious to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 295,476 people were diagnosed with the virus, for a total of 30,835,922 confirmed cases since the start of the pandemic. Yesterday, 5,066 people died of the virus, for a total of 957,790 COVID-19 fatalities and a mortality rate of 3.10%. The region of the Americas, which accounts for 50.63% of all cases worldwide, reported 117,512 new cases yesterday, for a total of 15,614,467 people to have been diagnosed with the virus in the region. Meanwhile, 2,644 people died of COVID-19 in the Americas yesterday, for a regional death toll of 531,148 and a mortality rate of 3.40%. The United States continues to top the list of countries worst affected by the pandemic, with 6,764,962 confirmed cases and 199,258 COVID-19 fatalities. India has over 5 million cases, then Brazil with 4.5 million confirmed cases, and Russia with 1,097,000. From the Americas, after the United States and Brazil, comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, the Dominican Republic, and Panama. These are the countries in the region with the highest number of cases. Cuba occupies 20th place on the list. Regarding mortality rates, Mexico has the highest with 10.55%, followed by Ecuador with 8.82%. This is the information we have on the behaviour of the pandemic in Cuba and the world.